does the guideline try to regulate? What does the guideline try to regulate? So whenever you read the question, please understand the question. The keyword in this is try to regulate. Okay, regulate. So you can working time regulations. Okay, so I think the question is, it is a simple question, I think. As a general guide, these regulations state that workers cannot be forced to work for more than 48 hours on average, and limits young workers hours to 8 hours a day or 40 hours a week. From 1 August 2018, junior doctors' hours will also be restricted. The number of hours should be averaged out over a 17-week period. Besides working time limits, the regulations cover working at night, health assessments for night workers, time off, rest breaks at work, and paid annual leave. There are provisions for workers to come to an opt-out agreement with their employers for defined periods. Should the nature of the work make this necessary, these guidelines are governed by the Department of Trade and Industry and also the National Health Service. So the passage is saying you about working time regulation. So you can read it once again and then we'll go to the question. So it is said all are getting some regulator working hours hereafter. So who all will be getting the benefit? It is said that, and what kind of agreement they are making with the employer is also explained there. You can read once more, then we'll go to the question. Okay, can we move to the question? Did you all read it?
Yes, ma'am.
Yes, ma'am.
Okay. So the question, what does the guideline try to regulate? It tries to regulate the number of hours of work permissible, uneven working hours for different profession, intensity of the work done in stipulated time. Very direct question. The number of hours, it tries to regulate the number of hours of work permissible, then uneven working hours for different professions. Okay, does it say about different professions, uneven working hours? Does the passage
No.
says that?
No.
No.
No. Okay, intensity of the work done in stipulated time. Does it talk about the amount of work has been done?
No.
The amount of work?
No.
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 So what can be the answer?
Yeah.
Okay.
The number of hours.
Number of hours.
The number
Okay.
of hours of work permissible.
Okay, what is permissible meaning?
I don't.
Permissible means allowed by the law.
Allowed.
Yeah, allowed by the rule or a set of rules allowed by the law. Okay, so the entire passage is saying that from 1 August, some rules and regulations for some rules and regulations for working time regulations, isn't it? So about the annual leave, it has been said, and like how many hours they can take off, and a rest break, and night shift, everything it has been explained. So you can see uneven working hours for different professions not been explained, and the intensity of work is also not explained. So the most correct answer is A. Okay. So shall we move to the next one? Any doubts in this? All right.
No.
Okay. Next question. The note emphasizes the significance of the difference. Okay, significance, note emphasizes the significance of the difference. Okay, difference by, the note is this: aggregated versus disaggregated data. So, what do you mean by aggregated and disaggregated meaning? Aggregated means, what is aggregated? Okay, nobody knows.
Figures.
Aggregated means,
collected,
yeah, it is collected or gathered together. Disaggregated means separated. Okay. Aggregate together means to bring together or to collect together or gather together. Disaggregate means to separate. Okay. So to ensure that services reach people in need, and that no one is left behind.
The difference indicate the
Okay, you're reading. Okay. That no one is left behind, strategic information needs to be useful in a way that helps the people, places, and situations where interventions are needed. As building block of strategic information, data can be combined or separated for different uses. Aggregated data are combined from many sources, for example, client records, registers, and surveys, and summarized for a specific purpose, such as reporting or statistical analysis.
significance of the
When aggregated data are separated again according to a specific variable, they become disaggregated. Disaggregated data can inform decision making and planning so that interventions more effectively reach targeted groups. You can read once more about the passage. It is the data is saying about aggregated versus disaggregated data. What is the purpose of aggregated data? What is disaggregated data?
ഞാൻ ഫസ്റ്റ് ഇടാവേ വേറെ വർത്താനം പറഞ്ഞു ഫസ്റ്റ് ഇടാന്ന് പറഞ്ഞിട്ടില്ലേ
Okay. So shall we move to the question?
yes,
Okay.
yes,
Okay, the note emphasizes the significance of the difference by. The note emphasizes the significance of the difference by indicating the contrasting purpose. So, significance of the difference means what? The word significant means what? Significant.
Important, ma'am. Important.
Yeah, something important, isn't it? Yeah, important. Okay, importance of the difference by. Okay, the note there is difference between aggregated and disaggregate means disaggregated data, isn't it?
Yes.
Two it was the passage is talking to you about two different data. One is aggregated and one other one is disaggregated data. So while you read the whole passage, the note emphasizes the significance, okay, the importance of difference by indicating the contrasting purpose. That is, the note is giving you information about the different purposes of aggregated and disaggregated data, or it is highlighting the informational value. Is the note highlighting the informational value or exhibiting the distinction and outcome? Distinction means what?
Difference.
What is distinction?
Difference.
Difference.
Yeah, distinction means difference. Yeah, distinction means difference in outcome. Okay, so how does the note, that is the passage, gives emphasizes or shows the significance of the difference? Is it indicating the contrasting purpose of aggregated or disaggregated data, or is it highlighting the informational value or exhibiting the differences in outcome? So what do you think is the most appropriate? Do you think it is exhibiting distinction in outcome? It is showing difference in outcome? Both data has its own importance, isn't it? That's what they say, isn't it?
Yes.
It is said aggregated data are summarized for a specific purpose such as reporting and statistical analysis. Disaggregated data can inform decision making and planning so that the interventions more effectively reach targeted groups. So is it trying to show some differences?
No.
No, both data, aggregated data as well as disaggregated data has
Yeah.
their own
It's not
importance.
important.
It's not important. So we can delete that option, exhibiting the distinction in outcome. We cannot choose that, isn't it?
Yes.
Okay, come to the next point. Highlighting the informational value. Is it talking about any informational value?
No, no. Answer is
No,
A.
ma. Yes.
Answer
Yeah,
is
ma.
A.
Yeah. Yeah.
Why answer as
It's
A?
in the
But
It is, yeah.
both have
it's
its own
showing
purpose.
purpose.
Yeah, it is
Purpose.
indicating the contrasting. Contrasting means what we will say, especially the women understand it better. Contrasting, the word contrasting, isn't it? Contrasting means it is showing off, it is
The
showing off the
purpose.
purposes. Yeah, the opposite. The opposite at the same time it goes together also, isn't it? So the answer is,
Yeah.
yeah, yeah, the answer is A. Isn't it? Any doubt in this? Clear to you?
Yes. Yes. Yes.
Yes.
Okay. So shall we move to the next one?
Yes.
Okay. The standard procedure for health surveillance must include. Okay, so you have got in this reading section, I could find out many words which is very difficult, the words which we do not use in our day-to-day life. Okay, so health surveillance. Okay, as part of the monitoring system, health surveillance should be undertaken if appropriate. The health of employees exposed to hazardous substances can be affected through absorption into the body. The absorption route can be inhalation, by injection, through the skin, or a combination of these. When inside the body, the substances are metabolized. Metabolites can target various organs of the body which can thereby be harmed. Health surveillance therefore requires biological monitoring. Okay. At its simplest, this could be a skin inspection ensuring no dramatic changes have occurred as a result of exposure to an irritant, through to lung function test and urine, breath or blood analysis. The criteria used to decide which type of surveillance is appropriate depend on whether a test is available. Tributyl thin oxide was once used as a limbo preservation treatment. However, it was not known how it was metabolized in the body and therefore no appropriate test existed. The potential for it to cause harm could be eradicated, and as many occupational diseases have a long latency period, up to 40 years for asbestosis. For example, tributyl thin oxide was withdrawn from use. So our question is, what standard procedure for health surveillance must include? What kind of standard procedure a health surveillance must include? Tests that require biological monitoring, formulation of tests for close scrutiny, constant testing to check for irregularities. Okay, that what is the standard procedure for health surveillance? You can read once again the passage.
Surveillance therefore requires biological monitoring.
So the question is standard procedure for health surveillance. Okay. So can we look into the question? Did you read it?
Yes.
Okay. The standard
Yes.
procedure for health surveillance must include tests that require biological monitoring, formulation of tests for close scrutiny. Close scrutiny means critical observation or like examination. Scrutiny, the word meaning scrutiny means examination or observation. Constant testing to check for irregularities. So a standard procedure for health surveillance, whenever we say that a particular test is applicable or it is good for health surveillance, it must include what? It should be that require biological monitoring, formulation of tests for close observation or close examination, constant testing to check for irregularities. Okay, these are the three options given to you. Okay, so you can read once more from the passage and you can come to a conclusion of the answer.
Biological monitoring.
That is about the skin or
Can you say that
biological
health surveillance therefore requires
monitoring.
biological monitoring? Okay. But it said at its simplest, this could be a skin infection. Okay. And when you come down, you can read the sentence. This criteria used to decide which type of surveillance is appropriate Depend on whether a test is available.
Available.
So that is from
Okay.
there onwards we will get the correct answer, because see, it is straight away said it should be having some biological monitoring. Okay, so what is the best option? They say that whatever test is being used, it should be available, isn't it? And also they have given an example also. Tributyl tin oxide was once used as a timber preservation treatment. However, it was not known how it was metabolized in the body, and therefore no appropriate test existed. The potential for it to cause harm could be eradicated, as many occupational diseases have a long latency period up to 40 years for asbestos, for example. So the example has been given. So from that point, how can you make an answer?
No. B.
Yeah. What is the answer?
B. B ആണോ മാം?
Yes.
B.
Yes, B is the answer. Formulation of test for close scrutiny. That is, the test, the standard procedure should be having a close monitoring, or like a close critical examination or critical observation should be there in that test procedure. Okay, so that is the most appropriate answer. So it requires biological monitoring, that has been straight away given there. But still, when you read into that sentence, when you go in depth of that paragraph, we can understand that. So did you feel anything from this sentence? The criteria used to decide. Did you guys read that sentence?
Yes, ma'am.
Did you feel that A is not an answer when you read this paragraph? At least that, since it has been straight away given the. No. Okay. So B is the right answer. Any doubts in this? Do you have any doubt?
No, ma'am.
Oh. Somebody has some doubts. Somebody is laughing. Who is that? Gino? Not Gino. Do you have any doubts? No. Is it clear to you?
Yes, ma'am.
Can I go to the next one? Okay. So, okay, you might be thinking. So when she says everything is right, that's what you're thinking. Okay. Yeah. See, you will get into the right track only through practice. Okay. So I'm really happy that many are getting A for reading from our institute. You might have seen the results. So it is only through their practice. So there is, like, those people are proving that there is more than a grade, like there is an above grade than B, isn't it? That's why they are scoring it. So definitely you all can also score that through practice. Okay. So the next question is, needle stick injuries must be handled by. Okay, what to do if there is a needle stick sharp injury? So this is a very simple paragraph. In one go, you will understand. Despite means what? You must be using in your letter the word despite. What is another word of despite? Nobody is using?
Despite.
Yeah. Despite means,
Even
yeah,
though.
in spite of, yeah. Yeah, in spite of, okay. So despite best efforts, needle stick injuries do occur. The injured healthcare worker must balance his or her risk with the safety of the client. The following guidelines can help healthcare workers address needle stick injuries. As soon as it is safe to do so with regard to client safety, the healthcare worker with the needle stick injury should stop what he or she is doing, remove gloves and wash both hands, and the area of the needle stick injury with soap and with soap and plenty of water. No antiseptics or scrubbing brushes should be used. If the provider is in the middle of a procedure, then another qualified provider should take over and complete the procedure. If no other qualified provider is present, then the injured provider should ensure that any critical step is complete, wash both hands and the area of the needle stick injury, change gloves, and then complete the procedure. should inform senior staff or managers at the clinic and follow protocols for managing the needle stick injury. Very simple paragraph, isn't it? What should a health worker do when they get a needle stick injury? What are they supposed to do? They have to,
Clean the hand.
yeah, they have to clean the, and that is like they have to like get away from the
Remove the
area,
glove.
remove gloves, wash both hands, and the area of needle stick injury should be washed with soap and water. No antiseptic scrubbing brushes to be used. And it is also said that if they are in the middle of a procedure, another qualified provider should take over the case and complete the procedure. And if they do not have any qualified provider in present, he or she should, the victim should make sure that the critical step is complete. That is, the patient who or she, who he or she is taking care of is out of the critical period. Okay, they are not in danger, and after that they have to wash the hands and complete the procedure. Whatever is been given, they have to do that. That is been given. So our question is, needle stick injury must be handled by. It must be handled by following the laid out steps for complete care, primarily completing any critical procedures, exercising caution and refraining from routine.
See?
It should,
A.
yeah, CA, and one more option. What do you think? Just think, they have given a series of things that you have to do in the passage.
Answer is A. A.
A.
Yeah, the most appropriate answer is A. That is, second one is primarily completing any critical procedures. They are saying any critical procedures must be complete. So the question is, it must be handled by. How they should be handling that?
Following the laid out steps.
Yeah, they have laid out a step for completing care, isn't it? They have written down a particular some particular things to follow, to be followed when they have a needle stick injury. So it should be handled appropriately, isn't it? Exercising caution and refraining from routine. So they have to refrain from all the routines. No, it is not said there. Only thing they have said is, if they are in a critical procedure, either they have to hand over the patient or else the critical step should be completed, and then they have to go to the laid out steps for complete care. That has been told there, isn't it?
Yes, ma'am.
Yeah. So the answer is,
A.
yeah, answer is A. It is very clear.
A.
Yeah, we'll go to the, I think